From Tidal Health Group, this is Health Impressions, where we break down healthcare marketing strategies for consumer brands with industry experts. I'm your host, Bryan Cush.
Well, thank you, Jerry and Carrie, for joining me on this podcast and this conversation. I'm really looking forward to it. I've gotten the privilege of speaking with Jerry in the past, but this will be a really interesting one, and I love having the perspective of both sides. So if you don't mind taking a moment, Carrie, kind of introduce yourself, just your background, context to joining us.
Yeah. So I'm with Complete Health, a senior primary care, value-based care company. And then before that, my background was in the hospital world. So spent 8 years with a full service hospital. So kind of got both sides.
Yeah, you sound so you've been through the gamut. So
yeah.
And Jerry, I know you've been on the conversations before, but just kind of give us a brief overview of your background.
So my name is Jerry Hobbs, and I'm from Prairie Dog. I'm president and co-founder of the Healthcare Marketing Group. We've been around for 30 years. This July will be exactly 30 years. And we've worked in 45 of the 50 states, partnering with health systems and medical groups and all things healthcare.
I think a great context for this call, and I think Carrie will bring in even more context as we continue to speak, is I'd love almost like a reset moment. And I'll throw this to you, Jerry, of so often marketing, I think particularly healthcare marketing, gets bucketed into these areas of communication or just short-term thinking. And I'd love for you, like, where do you start when you just have to educate someone about that there is a science and scientific approach to marketing?
Yeah, it's funny. We work in a category in healthcare that is very much driven by a very clear process, right? A very clear discipline of diagnosis and then strategy, if you will. How we're going to, address this, what we've learned, this problem we've uncovered and understand now. And then what are the different methods? Are we going to do surgery? Are we going to do, something non-invasive? And then did it work, right? Well, that's the same process we use in marketing, always has been, but it hasn't been applied necessarily in our category like it has been in other places. Was part of a pitch yesterday. We were finalists for another health system account. And one of the things they asked us for to address was, can you help us build our marketing capabilities, help our team become better marketers? And I was really encouraged to see that. We wouldn't have probably saw that 30 years ago, even 10 years ago. So much of the work has been very comms oriented, very PR oriented, very ad oriented. And there's an increasing awareness, understanding that we've got to get more sophisticated. When you work with doctors, as Carrie does every single day, they'll fill the vacuum if we don't. And when you bring a process, the marketing process, to the table, which starts with data, understanding your audience, and evidence to build to a strategy and make a choice, and then decide how you're going to execute, they respect that incredibly. So I think we're at a good point. We're improving, and I think just the request in that RFP to have us address that as one of their goals was a good sign.
Carrie, what does that trigger in you, having the experience on kind of both sides of the coin, on the hospital side and private practice side? Did you find yourself having to really show up differently in those settings, or was it really a similar problem trying to tackle the kind of education science gap of the perception of marketing?
I think it's been similar across being part of a medical group or in the hospital. And I think that, like Jerry was saying, you just have to educate the providers, the stakeholders, and tell them everything that you're doing and the why and the data. That's all they want to know. They want to know that there's science behind it, that there's a reason why you're doing it. And a lot of times, because those individuals aren't our target demographic most of the time, they're not seeing what you're doing. And so you have to tell them, because they're not seeing it as a consumer most of the time. And there can be some difficult providers or physicians to please, but I think, they're human just like us, and they want, if you can show them, they like data. You show them data and the proof and the thought and the effort and the strategy and why, you can usually get them bought in. And then they'll be advocating for what you're doing to other people. So you got to start with them. You got to start with the executives, stakeholders, whoever that is. But providers are really important. Yeah.
There's been oftentimes when we're talking to clients, to marketing teams and different healthcare organizations, one of the things that they really are frustrated by is this tendency to be seen as order takers. It's a pretty common phrase that you hear from healthcare marketing teams. And, we've made that a kind of a mission from the beginning to help them not be order takers, but to be marketers, to be consultants, and within their organizations to be experts in a very important discipline that still is gaining trust and respect. And as Carrie said, the process, if you follow the process, doctors will, they'll begin to respect that. I remember years ago we were helping a health system. It was a specialty of a children's health system. We were helping them introduce a new way of working with their departments, their divisions, using this approach, more evidence approach. We brought data to the table, and we were showing this pediatric cardiologist where their volume was coming from, what the source of it was, the origin, not only demographically, but from referring physicians, and where it was not coming from. And we began to talk about their issues and their problems, not what they needed us to do. Not that they needed a billboard or a brochure or whatever, but their problems. And I was really, they were very pleased. I remember the meeting, usually they're ready to go, they say their piece and they're out of there. In this case, they stayed afterwards and they said, "Can I see more of that data?" And we sat and they had questions about it. And we dug into it. And they were excited about it, and they asked for, can you look at it this way? Can you take this cut at it? Well, certainly we can. So we had them engaged, to Carrie's point, by showing them information that they could use with us to make good decisions about what the action should be. We don't just jump to an ad. We don't just jump to a billboard. In that case, we had some things we would do with, just protocols and ways we would work with the referring docs to reduce wait lists, so by making sure the primary care doc, the referring doc would do things in the practice to get them ready, that they could handle theirs. So we would put the right care at the right place. And they saw that all of a sudden as marketing, not just an ad's not just marketing anymore. So, if we can convince them that they don't dislike marketing, they need to understand it more thoroughly. And it's not just taste and nice pictures. Like they tend to see it as if we let them.
Well, I think that's why it's key to have a really good relationship with operations. Yeah. That's where you can really show your value. Being close in the loop and a partner with operations, because we kind of have an eye where they're very operational focused and workflow focused, where we can also bring in reputation, perception, patient experience pieces from a marketing standpoint. What are we advertising and who are we actually? What are we actually providing and what are we saying that we're selling? It's so much more than just ads. And another thing from a provider or stakeholder standpoint is something that I found successful is, a lot of times they'll just say, "I want a billboard, I want this, I want that." And it's really just saying a way that you can really get them to understand that there's thought behind it is, that sounds like a great idea. Like, let me do some research to see what the best thing is to do for, what's your end goal? And then we need to start there. And what's the best thing to do? Everything doesn't work for everything. You really have to review every scenario and do the science and the process and figure out what the end goal is. And I think we did that for Complete Health for when, years past, it was very annual enrollment period focused for our advertising strategy, to standing back and going, well, what do we really want the patients to do? What do we really want the consumer to do? They're going to sign up for Medicare. So that's not necessarily what we want them to do, right? We want them to choose us when it's time to sign up for Medicare. Medicare because we're a great Medicare provider and, that's our specialty. And I think it's just stepping back and it can be a shock, right? Because in our culture, it's always, what are we doing for AP? What are you doing for AP? What are you doing for AP? And enrollment period. And now it's like we're doing things all the time. And it was for a minute, they're like, okay, sure. But now that they realize that the communities they know who we are now and our name's out there and we're doing things year round, or that we're doing things, it's not all crammed into a 2-month time, is a huge, and that's just being tied into operations, being tied into just what do we need to accomplish? What do we want to accomplish?
I think you bring up such a good point around like the annual enrollment example. And I'd love, Jerry, for you to frame it from like the scientific method is like, that's such a fixed period in time. That's only a small snapshot of a year. If you just took the concept of a year, like what does that bring in you that kind of causes friction about some of the false choice dichotomy between brand building versus acquisition?
Yeah, boy, I wanted to go another place we can pick up later around, but I'll go there.
You can do both. I have faith in you. You could bridge it together.
Do you mind? I have a story that the first part of Carrie's comment triggered in terms of it's not always an ad and how we gain respect. And I told this story yesterday and it's fresh on my mind. It's been one that I've been really pleased with for a long time. I won't tell you who, but one of our clients in a major metropolitan area called one day and they said, hey, we have an nationally known cancer program is building a center in our backyard, and we're terrified, honestly, is the word as I think they used. What do? We need a campaign to kind of head this off. We need a consumer campaign. I remember the account director estimated the placement and the production of that campaign to be, I'm pretty bad with, I can see it in my head, $1.037 million. And she came to me and she thought I'd be really pleased, like, oh, that's new business that we didn't expect. And I said, well, sure, that's what we need to do, because this is the way. Wait, why are we doing that? Is always the way I am, and the way we try to always be as a group. And I said, can we stop and kind of look into the problem and understand it better? So we did. What we found was really bad patient experience issues. We had contracts with subspecialists that were cherry picking business away from us. We had a medical director that was not respected by the referral community, and some clinical pathway issues. And we also then had a major, we found that the majority of their business for this particular, for this cancer service line was generated by their owned physician network, right? But not nearly enough. I think it was less than half of what the potential was being realized. So there's a lot of leakage. So we go back and we say, it's not a consumer campaign because you're not a blip on the cancer market like this place is. We need to not fight the war outside. We need to fight the war inside. And we focused ourselves on fixing all those clinical problems, the product problems, and the contractual problems. And most importantly, set ourselves out to earn all the referrals of that major, employed physician practice group that we were losing. The net effect was a year later, we had an incremental increase in volume of 679 cases. The CEO, I'll never forget, it says, so that's what marketing really is. I go, yeah.
Yeah, it's like you don't take the order. It's like you're not order taking, you're strategizing a solution to a problem.
Yeah.
So, and I think when that group you were talking about in the beginning said, how can you make our team better marketers?
Yeah.
I think that's the skill you have to flip, is you don't always have to do what they ask. They don't know what to ask. They don't know what the possibilities are. They don't know what they need. You know what you need. So you're really asking, you're not taking an order for a flyer you're taking an order for a need, and
What's
then
the problem?
you need to solve their problem and let them know why your recommendation, why you do it. And then that's the science behind it, right? Then you're telling them this is why, this is what we're going to do. I think that's
Don't drop off brochures at the local pediatrician's office. Engage them in a discussion about what are their biggest issues, and so turns out, often turns out that it's something that's mutual, and you need to reduce a wait list, or you need to provide protocols that'll help them manage care better. I got a call another time. I might have shared this with you, Carrie and Bryan, but it comes to mind. It got a call and said, our MyChart registrations are stalled out at 30%. And we don't understand. We need a campaign to improve that number. Okay, but can we stop and look into it a little bit? I said, okay, are we sure that's the right solution? Long story short, we found out that registration was failing. When they tried to register online, it didn't work, and they would try and they would give up. There was no support to remedy that. And so any money we would have spent on a campaign to generate more top of the funnel action would have just been thrown in a hole, so to speak, because they would have been frustrated and abandoned the registration process. So the marketing objective begins to be fix the registration process, not generate more demand, because they already had the demand. They were just the ads were killing them essentially. So that's the stuff that I think is so important for us to continue to talk about, and because it's real value. And when you work with a service line director or a physician and they see that come out of the marketing process, all of a sudden we're at the table with a whole different role. We get involved in product development. We get involved in fixing problems that are, keeping us from wasting ad money. It's not always an ad.
I mean, sometimes it's like, we don't need an ad, but what do you need? Back to that, make it look pretty.
Yeah.
Do something pretty for me. To maybe it's not an advertisement or whatever, but is it a resource that your department needs that I can help coordinate or help you refine a process or intake information? I don't know. Flow on the website or something, or a form or whatever. I think you have to have strategy, not just doing tasks.
And I love this. There's a new book. I like to read books. Bryan and I share books back and forth a lot. And I'm reading now, I'm about 4 chapters into a book called Algorithm. And it is written by, I think, James McNeil, who was the CEO of Tesla. And this story, to me, is what I want to be more like as a marketing consultant, as a marketer within a health system, within a medical group. There's a problem with the efficiency of, they just weren't fast enough and efficient enough with the assembly line in terms of the Teslas. And you might have heard this story, but the guy went home and he thought about it. He comes back to I hope I'm getting it right. He comes back to the boardroom later that week, and he has a matchbox car. He tosses it onto the boardroom table, and he says, "Take a look at this." He says, "It's just 2 pieces." And he said, "The chassis is 1 piece." He says, "In the auto industry, we weld them together from multiple pieces. We think that's best. But can we use 1? And if we did 1, wouldn't it be much more efficient?" So by asking good questions like that, by thinking a little bit outside of our norm, which we can bring to the table as marketers, because we do that. I mean, I think we listen to the audience. We get ideas from them. We get ideas from just being very humble and not knowing what we don't know. But just bringing that to the table, they completely got ahead of the whole industry in a new innovation. And I think those kind of things can come from us. I think they can come from marketing, and I think that's kind of
I think you just have to not be afraid to throw it out there, and maybe it sticks, maybe it doesn't, And I had a president a couple jobs ago, and a lesson he taught me that I've just really lived by is, just because it's the way you've always done it doesn't mean, you have to do it. Or another one was there's more than one way to skin a cat, whatever. One of those things is like, why do we do this? And not in when, if somebody comes in and is like, I need this marketing or whatever, well, I'm, in a professional PC way, like, well, why do we do it this way?
And you have to be careful. You have to be careful as a non-clinical person.
Yeah.
We coach our clients who come from outside the healthcare world, and you've been in it your career, so you understand this, that if you go into a clinical setting and you step too far, because that's not your turf, it can backfire on you. So one of the safest things to do is to, as a good marketer, use market research, use consumer perspectives as a way to use evidence, like you said earlier, not just numbers, but qualitative comments and learning from our interactions with all these different audiences, including the referral. I've used referring physician quotes to convince doctors that what they thought was exactly what they should be doing might not be so right. It wasn't me saying it. It was the people they were trying to get referrals from. So it's a fine line, as you kind of work that respect thing. So.
Yes, it takes a long time to build that trust and relationship and respect to be able to say, do we have to do it that way?
Yeah.
And not have them be very, and hey, maybe they will.
Who are you guys? You're just marketers. You have to be strategic about have a strategy about how you bring it to the table, I guess, right?
Yeah.
So let's talk about Bryan's question. I'm sorry.
It was the question?
I do that all the time, and he knows I do.
Well, it's funny.
Bring us back on track.
There's a fundamental theme I hear in both of you that I think is just so difficult, even on like a human level. Of it's not just, is this the right solution? Going, is it a campaign or an ad or a leaflet? Is this even the right question? Like you're flipping totally. And that, I think that's what I hear from both of you is like, now we're about to bump into just ego. And how do we approach that to go, okay, like you started to allude to it a little bit, Jerry. I'm curious if we can press further of this. Okay, is it some mix of qualitative or quantitative of just like, how do you approach going, are we even asking the right question?
I guess, I believe in that, the wait, why mindset, the we don't know what we don't know mindset. The number one rule of marketing, as you've heard me say and even write about, not my idea, just it's what you get taught when you take a good marketing program, is that we don't know anything. You have to start with market humility. And if we bring that to the table and we go, I think if we bring audience insight, whatever that audience may be, to the table, that's going to arm us with, I used to say, I don't know who said it, but information is power. I remember when I was hired me after an internship. I didn't have a college degree till they finally paid for my last year. I would go to the table, and I liked data and I understood research and I trained in marketing. And it was kind of rare in that hospital that I started in. And I would bring that to the table, like, here's what our market share is, because I learned how to use rates and determine it. And we did these focus groups. They didn't know what focus groups were. Or, I sat down and talked to these doctors or these people in this clinical area, and this is how things are working right now. And they're wondering if that really makes sense. You bring that information to the table, and all of a sudden you become valuable.
Yeah, getting a seat at the table.
I think that's part of it, right?
Yeah. Marketing's not always at the table. That's what I think is a shame in a lot of organizations, is elevating marketing to that part of the conversation and always having them there. And I know I've had a mentor in my life that was, it's a privilege to be at the table. Yeah. And so when you talk about, like, you need to recognize you're not clinical and you don't know.
Yeah.
You don't know it all. There's no way you can know what's really going on behind the scenes to some extent. So you just kind of speak when it's valuable and just take it all in so that you can go back to the drawing board and do what you need to support them. But when marketing's not part of it, it's a real shame, I think.
I also would say this, as a really young person, I've always been very curious and skeptical of everything. That's my nature. And I also want to know I want to feel more confident in what I'm talking about instead of just shooting off something.
Yes.
And so I spent a lot of my time wandering around the hospital, picking people's brains. I know that sounds, but, and I still have time for anybody who wants to pick whatever's left of my brain, but because of that, and I still have lots of mentors that I sit down and talk with and learn from. But I guess to get to the point, I learned about billing. I learned about coding. I learned about how we negotiate with payers. I learned about what our costs are. Ultimately, I had a cost accounting system on my platform, on my dashboard, and I had the data for the market on our dashboard. I had our performance data. I mean, I knew the data I learned the data that informed how the business works. And I sat down with the CFO, and if you ask someone for help to learn, they'll help you. Doctors, I would go to the lounge and hang out and learn from doctors.
Doctor's Lounge is a great place.
I was at it used to be even better, right? Because now we have hospitalists, but in the old days, It was a wonderful place. When I was doing a pro forma to decide if we wanted to acquire something or a new piece of equipment or something, I wouldn't just do the numbers. I would go out and talk to the physicians who would use it and people who referred to the people who would use it and see what the climate was, right? And I was at 3 years ago, was at an early bird thing, a discussion at one of our national healthcare marketing conferences. And they asked me to come and just be someone to help with it. And we had heard a presentation, a keynote by, I forget his first name. I should know it because I've never heard him all my life, but Kaufman. He's a wonderful consultant, knows the business. I learned everything he said. He was presenting basically healthcare 101. And boy, I'd heard it. I learned it at a young age. I'd been embedded in Ernst & Young and heard it from those people and just over the years. And this one young person said, why are we listening to this guy tell us about our business? We don't need to know that. We're marketing people. We're communicators. And it's just like, that's a problem. If you don't understand the business, you shouldn't be at the table. Mm-hmm. And I think as a marketer, you better know your business and you better know your audience. And those two are almost prerequisites. They are prerequisites to be at the table. So I encourage everybody, get out of your office. I know they're not always these days, they're not always in a hospital. There's a big health system. Get out, walk around, make friends, learn, develop relationships, get a handle on your business, because that builds credibility in and of itself. Little humility, right? It goes a long way. And when you ask these people to teach you something, Chris Matthews' book on politics years ago, I read a long time ago. One of the things that stuck with me, when you ask someone for a favor, they are your ally almost for life because they've invested in you. And that's a good thing too, right? There's so political in these big health systems. So all those kind of things are smart. I know I'm rambling, but maybe there's some value in some of that.
Well, and I also think, how you said, get out and learn. I think it's really important that you explore things, figure things out on your own as well, right? Like what dashboards are available to you? What can you get your hands on where you can keep a hold of the pulse, and only having to ask where you get information once. Oh, if you already send a report on that, can I just get copied on it? Like, I don't want to, I'm not going to, but just loop me in so I can get it on my own. Like when I was in the hospital, I was getting the census every day, twice a day. Mm-hmm. I was like, I want to know how, I got to the point where it's like, how many beds do we have? How many surgeries are on the board today? And thinking that marketing should be embedded in that, some people may disagree, but, when every trauma patient that's, what's going on, they're coming in, whatever it is, how full is the ER, what's the wait time. I mean, that all it makes you more immersed in the operations so you can only serve them better. People say, oh, well, we've been turning an extended wait time lately. Should we turn down the ER advertising for a minute? Now it's really short. So should we turn it back on? Or things that people don't, then you can start doing it without being asked to do it, because it's, oh, hey, we've turned this up because we've noticed the volume is down or whatever. That's going to gain you respect too.
I wrote a blog recently. It's not been posted yet. It's one of the 3 new ones I've drafted. One of them is about AI, and it's about how we leverage it. But this one, it just, this topic is what caused it. And it's, now that you have a seat at the table, this is not the title, but it's don't screw it up is the idea. Because we get seats at the table sometimes just because that's kind of maybe more accepted today. But you better use it right. You better be a part of the business. You ought to be a part of growing the business, actively involved in the business, totally integrating marketing into a key factor in that whole play, not just, communicating what the strategic plan and the internal, all that, but you're there to help grow that place. And
you got to add value. You have to contribute value.
Mm-hmm. And we once we get the seat, man, you better use it well.
And the more value you add and the more you tell people what you're doing,
the
more they're going to be willing to invest in marketing.
You have a job to educate.
It's a big line item that doesn't have a very clear ROI measurement most of the time. So if you're not telling the stakeholders what we're doing and the success, and that you're doing it with purpose to align with the strategic goals of the company, it's a pretty easy decision in tough times to cut the line item. And so you have to build it up that it is important, and not just for consumer marketing. It's so much more than that. It's supporting your operations. It's, I just think you've got to be tuned in and earn that level of respect and engagement, and tell them often what you're doing and how it's performing, good, bad, ugly. And if it's bad, we're pivoting, and it's being paid attention to, it's being monitored. We take that investment seriously and we're spending it wisely. Know there's thought behind it, because the marketing budget is the first to go.
Yeah, we in that pitch yesterday, one of the other goals was show us how you maximize our marketing investment and how it relates to, growth of the organization. And they specifically asked that about brand, not just about performance efforts. We showed them both, but they had case studies where I had this one where it was a really great brand solution, we thought, and it translated immediately in terms of preference and some of those numbers, right? And then the lag is, does it translate in terms of volume? And it did. We saw every year for 5 straight years, we saw an increase in market share. And we've been invited a few times back to the board meetings to celebrate those kind of things. And that's when you all of a sudden go, okay, maybe we're getting a little traction here. Let's talk about this brand thing, Bryan. You did it a while ago, and it is a big deal for me, and I think it's been a really big deal for us, Carrie, at Complete Health, right?
Yeah.
I'll tee it up and we'll see where we go, if that's okay.
Yeah, I think it's a perfect transition. We've kind of spent the front half going, are we even asking the right question? Like, there's a level of research, there's a level of diagnosis, but now we need to prove that thesis. And I think that's kind of the arc now, as you start to look at that example of, you spent the time increasing brand preference with the intention to increase market share, with the intention to increase patient volume or surgical volume. So how do you start to now look at that framing to prove the proper research?
I'll just set one quick comment aside about brand. You have private equity investors in your company, right?
Yeah.
And it's a whole different. So in the merger and acquisition and the investing world, which is increasingly active in healthcare, the brand also plays a big factor. In the short term, it's kind of a fun little juggling act because you want to see immediate returns, and we'll talk about that. But in the long term, most of the time in merger acquisition, the brand has value. The more you can build the mental availability of your brand and the equity in your brand in terms of being a known entity with understood value, it has balance sheet value. So I think that's an important thing for us to never forget. Yeah. There are people who have attempted to do that valuation in healthcare, and there are people outside of our category who do it all the time, put a real number on the asset value of the brand itself.
It's something they ask for. If someone's looking to purchase or when a company's up for sale, and I've had experiences in the past here that they ask for the marketing. I mean, they want to see how professional, how consistent your brand is, what you're doing. I mean, it has a value. And if you can show a robust plan that you're, firing on all cylinders, it increases the value of your company.
Yeah, and there are brand valuation models that are out there that I know the University of Kentucky, there's a guy, I can't remember his name. I think it's Gobleski. I don't know if he's still there, but he was really into that a few years back and did some really interesting work in brand valuation. But the more relevant, the more everyday thing is this. Over the years, digital marketing is a really great thing, right? But it just like any shiny object, something new, it can cause us to do not so smart things. And what happened when digital marketing, and I use that in a real general way, short-term performance marketing became so popular is if you look this up, you'll find a study called The Long and Short of It by Les Binet and Peter Field from the UK. They used the IPA database to study the effectiveness of campaigns over a period of time. And what they found is that advertising effectiveness, campaign effectiveness was declining for several years. And they use an econometric model to determine that. And what they found was the end culprit was we were out of balance. We were using too much performance or short-term marketing, short campaign to get the click, to get the quick ROI, we thought, and at the expense of longer-term brand building marketing, which takes time, harder to measure, all those kind of things. And so ultimately, they pointed that out. We still have an issue with that. I think it's begun to change. But what brand building took a hit, and it became less and less of most companies' marketing. Until I have one of the case studies that's really pretty cool. And you see a lot of Fortune 500 companies have taken this into account and have flipped. But one of the first to do it was Adidas. Adidas, I can't recall why, but they lost access to their paid search and some of their digital work for a while. And what they found, they were spending, I'll just kind of ballpark it. It was like a 70-30 spend on performance versus brand build. I think it was 67 to 33 or something. I can't do math this morning. But that sort of thing. What they found was when it turned off, they didn't lose volume. They didn't lose hits on their website. It didn't take a hit like they thought. They were panicking. And so they did their own modeling in the spirit of Bennett and Field, and they found that the 30% roughly, it was even less than that, of their marketing spend was actually driving the majority of their growth and not the performance marketing. So they flipped the equation, the spend on their budget. And they've done that ever since. They talked about it nationally. You can find Simon Peel, Adidas talking about that. Same things have since happened to places like Airbnb and even Procter and Gamble and Unilever. A lot of people have taken that approach. Amazon, which is kind of an anomaly, but the point of it is they're both good, and it just got out of balance. You need them both, and the idea there's a I think it's Roger Dawes came up with this. He's part of the Ehrenberg Institute. This rule of thumb called the 95-5 rule, and I spoke about this a couple of years ago at, I believe, either Shishmet or the Forum with one of our hospital presidents, system presidents, who's become a marketing convert. And Bill Robertson, I'll give a shout out to Bill. I love Bill at Multicare. And essentially what that rule is 95% of the time, people aren't in the market to buy what you're selling. 5% of the time they are. And so the concept that comes through with this is we need to maintain mental availability, which is brand building. Make sure people know who you are. So when they get into buying, in the place where they're buying something, they think of you, not just generally, and you're not just lost in the whole scheme of things. And so a brand is making yourself, having mental availability, being easy to know and easy to understand. And it's and then having physical availability, could say virtual these days, and that is being easy to buy. So brand building is the mental availability, and physical availability is the performance marketing. All the digital things that are more targeted and more capturing you when you are in the market to buy. And we've fallen out of balance. And in healthcare, it's probably more like a 70-30 balance that we should aspire to. Frankly, the digital's cheaper too, so that certainly helps, right? But we've made that transition at Complete Health. You mentioned earlier on that there was a focus on the annual enrollment period. Well, if people don't know who Complete Health is after they've signed up for Medicare Advantage or Medicare, how are they going to pick Complete Health as their practice? You get it? Right? So we need to build the brand so it elevates your activity during annual enrollment period. So if we're building mental availability as people age in all year long, we're going to have better success when they see or encounter our digital, our paid search, all those things, our direct mail, the things that are giving them an opportunity to pick us. And that's kind of the concept. I know I went on a bit, but
I mean, what do you see? How do you see that now with the AI world and, needing to tie into that?
I think Bryan probably is the best person to ask that. my quick answer is we need to build authority everywhere. I would equate authority with the idea, Bryan, those are terms Bryan's used and I love them, with mental availability. We have all kinds of offline authority. We just need to make it available in, when the consumer is trying to access it increasingly through AI and through online activities. So the answer is a multimedia mix brand that is complemented by a performance marketing to capture you when you're actually buying. It's like growing the tree, and then the performance marketing picks the fruit. It's like the harvest. I don't know if that I'm an old farmer, but that's kind of the way you might see it.
Well, at the root of it, I think, is a very robust website that's there to feel it all.
I think it's just an extension of the concepts that Jerry's been talking about. We're just now talking in a digital landscape. And I can tease a little, and I feel like we're probably going to be at a stopping point to go, this is going to have to be a whole nother conversation, but I can at least bring some context to that question. I think that bridges the brand versus performances. And I have to call out our senior developer. There's a research that just came out of Stanford. There was a Stanford AI index that we've been looking internally that almost 93% of symptom searches now trigger an AI, like an AI overview. Yeah. And really the way you look at that is that's a brand opportunity now, because they're citing where they're pulling that information from. Yeah. And the users don't trust the algorithm, they trust who's cited.
Yes.
And they make that very clear in pulling your logos, pulling the visual imagery that now associates that person to a brand. And that's like AI is just really democratizing that, because an AI overview is still within the parameter of a Google search. But now if you think about the parameter within ChatGPT or Anthropic, people are using that really as a search engine. So that's a whole nother playing field is your brand even being cited in these non-branded queries? And I think it's just an extension of this conversation that way too deep to address in a few minutes, but it's just another opportunity to go in that moment of symptom search. I'm not ready to purchase care, but I'm creating mental availability associating the brands that got cited by AI. Yeah. So you're going to lose the battle, and 3 months later, when that person which said, I'm experiencing slight knee pain, is now going orthopedist near me, they've already got associations to brands because they've been researching symptoms.
Yeah. You have to be present, you have to be known, and you have to be understood, right? You have to have those associations that give you that authority. I mean, it's so funny that just the present part got lost a lot. In that time where we just kind of said, it's too expensive to do brand building. We're gonna do this, some of these things that are much quicker, much cheaper. And I have a neighbor who's a former bank president. We were having this conversation one night about all that, right? I don't know. He seemed to enjoy it, and he said, it makes me think. We used to have branches everywhere, all over the and they were bigger. Now we still have them. People are all online with their banking, but we still do it. He said, it occurs to me that these young execs realize that when you drive around, you need to see our logo on these tiny little boxes that are now our brand. And they hardly have much activity unless maybe more senior people with habits like that.
Oh, so it's part of their marketing strategy.
He sees them as billboards, essentially, as building middle availability. They may not, and then the online is if you will, the easy to buy in many cases. But I drive by and I see U.S. Bank or whatever, and I don't go in the bank, rarely, if ever. Good. Isn't that funny? Lots of ways to build mental availability. So
I want to be really appreciative and respectful of you guys' time. I feel like this is a perfect tee off to go. Like, I knew we were going to have a part 2, but I hear like a part 3 and a part 4. So I appreciate both of your time. And I think it's just such a continued battle to kind of educate internally and externally is what I hear from both of you.
Yeah.
Well, I just saw a text flash across my screen here, and there's some news about this RFP, so wish me luck.
Great. Good luck.
Well, that's a perfect closing off point. I appreciate both your time, and look forward to part 2.
Thanks for listening to Health Impressions. Subscribe on your favorite podcast platform so you never miss an episode. Leave a review to help us improve, and connect with us on social media. Keep exploring, learning, and pushing boundaries. Tune in again soon.